Hello, everyone. I am Dr. Sri Banerjee, and today is a very special day. Today is World Diabetes Day. On this day, I would like to talk to you a little bit about diabetes. Recently, I personally was told that I actually have prediabetes. And so, since the last time going to the doctor, I've been doing research as a health consumer, trying to understand how to better tackle diabetes. But the irony of this whole diagnosis is the fact that for the last decade, I have been involved in many research projects and have published in peer-reviewed journals regarding diabetes. So today I'll be going a little bit more over some of the research that I've conducted and relating this to a lot of the current sort of diabetes guidelines and standards that have been provided. So I'll go over, like I said, a lot of the diabetes publications. But before I go into this, I want to make a note of the fact that according to the Centers for Disease Control website, prediabetes is something that is considered preventable. So what that means is that individuals that do have prediabetes do not necessarily go on to having diabetes. So that's one fact that is really important to keep in mind. But I wanted to go further and really understand diabetes from also a societal level. So diabetes was considered a chronic disease, which in healthcare practices everywhere in clinics, um, you would see this in many of the patients coming in. So, something that I took note in many of the places where I was seeing diabetes is the fact that a lot of the glucose levels, a lot of the HbA1c levels, a lot of these consistently stayed high. So I would be seeing values like 8, and therapies that would like insulin that would be considered mainstay to control these would not work. And so some of the early research that I was looking into was understanding why this disease would not be under control with regular therapy. So the first study that I actually published was not quite a study, but a singular case report. And the reason this caught my attention was because this was a case where an individual had diabetes, and again, regular uh, therapies like metformin and even insulin was not quite effective. And then this individual was put on something called biologic DMARDs. So disease modifying uh, uh, agents, which disease modifying agents, which are actually used to treat autoimmune conditions. So a biologic DMARD was administered, and subsequently, I showed through a lot of graphs the HbA1c and the glucose levels actually went down for a considerable amount of time. So this demonstrated very importantly the key role that inflammation plays in a lot of chronic diseases. And so I was already simultaneously working on a PhD dissertation pursuing and understanding better the role of key inflammatory biomarkers like C-reactive protein and homocysteine. So these were inflammatory biomarkers which I started to see were playing a role in diabetes as well. So I wanted to better understand this phenomenon, and in the context of diabetes, I went on to find out about another sort of disease which I saw in a patient in a clinic, which was something called latent autoimmune diabetes of adulthood. Now, this was a condition that seemingly, something LADA was something that seemingly many physicians would have been familiar with, but the reality was we had not been trained in recognizing this sort of disease. And so it really was important for us to understand better how to diagnose this disease. Now, why was it so difficult? Because this had characteristics of both type 1 and type 2. So, what do I mean when I say this? So, there was a sort of inflammatory sort of um, biomarker and a specific autoimmune marker that was found in patients that were having LADA. And so I provide a detailed account of a lot of the literature. Within a span of about 10 years, a lot of the recent literature as of 2017, I provided a synopsis of. So then, going into 2017, I was trying to understand how diabetes played a role in the context of relating this to cardiorenal syndrome. So, cardiorenal syndrome is simultaneous sort of dysfunction of the heart and the kidneys. So, when this happens, and then you think of diabetes, um, kind of a chronic disease that affects both organs, then this exacerbates a lot of the symptoms and leads to poor health outcomes. But I want to kind of stop here and take a moment to go back to about 2011, 2012, when I was exploring a lot of the social determinants surrounding diabetes. And so I actually conducted a mixed method study, which was exploring a lot of not only health literacy issues regarding diabetes, but exploring this in the local Hispanic population, specifically in Spanish speaking individuals, and how diabetes knowledge varied between different linguistic groups and ethnic groups. So that was another aspect that I was exploring. And then, so finally, this year, kind of as a culmination of understanding the social factors and understanding some of the biological factors, um, I worked with a team and was looking at two very important elements. So, one relating it to food insecurity. So, again, that's a very important social factor which comprises one of the five social determinants of health. So, what do I mean by that? So, economic stability is one of the five key social determinants of health, and food insecurity has been identified as one important component of economic stability. And so, Healthy People 2030 has specific guidelines on how to tackle food insecurity. Now, this research and publication is extremely important because it actually informs how practitioners can really address diabetes and food insecurity simultaneously when considering somebody's heart health. And so that is something that is important to keep in mind, especially today on World Diabetes Day. And then finally, you have the disparities in long-term cardiovascular mortality, and these disparities existing by race. So, Black Americans, especially women, were shown to have more severe outcomes in cardiovascular mortality if they had diabetes. So that basically sums up all of the research. I wanted to leave you with this fact that it's almost 100 years since insulin was first administered to Leonard Thompson. So that's something important to note. Thank you for listening.